Guna Blunt is a healthcare hero because one, she's selfless. Two, she loves people, she loves her country, she loves teaching. And three, she is a born educator. As a healthcare hero, Guna goes above and beyond. As a director, for instance, in her job, she is constantly mentoring. She leads by example. She will take them, direct them, and teach them. Same thing in the community. She's constantly teaching, focusing on the diaspora of the Haitian community. She is also a member of Doctors Without Orders. She does missions in her country and all over the Caribbean. With the COVID, she spends so much time educating because everyone was afraid, it was the unknown. But she and her team constantly were trying to get, and even doing testing, getting people to take the vaccine, getting people to participate. Guna is very compassionate. You got to have compassion if you want to be a nurse. You got to love people. And that's what Guna does. She loves people, she educates them, she's selfless.
Joe Feliz is a healthcare hero because he's an amazing critical care nurse. His skills in the bedside are phenomenal. I've been working with him for over 15 years. He's also a leader in the field, and through the pandemic, he has helped redesign our practices so we can provide not only care to our patients with COVID, but a safe care for the employees that were dealing with COVID by doing the appropriate protective equipment, by doing the appropriate measures. And we sort of redesigned the entire hospital in a way that we have a concept of vertical isolation, that we separated the patients with COVID and non-COVID. And Joe was in the forefront because he knew exactly what happened at the bedside, and he knew how to articulate at the leadership table when we come into difficult decisions. And as a matter of fact, interesting enough, because we obviously had a shortage of nurses that we had to work with agencies and other fronts. And at some point, we have a lot of nurses coming to us because they want to work with us because the safety of our employees was at the forefront, and Joe was responsible for redesigning how we did and how we deliver care. He was also influential in the country because we had several publications, and Joe was part of some of the publications that we have in national renowned journals. He's also now on the board of the Society of Critical Care Nurses, so he not only has a voice at the bedside, but he has a voice at the leadership table at the hospital, as well as in the country in terms of being a healthcare hero and a leader in critical care nursing.
Dr. Tammy Thomas is a true healthcare hero because she has improved the distribution of primary care throughout the state of Florida, particularly in rural areas where healthcare is needed so drastically. Her research has helped parents to bring their pre-adolescent children in to get HPV vaccines to prevent cancer in their older years. She's also a healthcare hero because she has set up a statewide training program for sexual assault victims, nurses to take care of sexual assault victims throughout the state. It requires a healthcare provider who not only emotionally supports the victim of sexual assault, but also in their examinations properly preserve the evidence so that the person who conducted the sexual assault will be prosecuted. Dr. Tammy Thomas is absolutely outstanding as a nurse practitioner, as a leader, and as a nurse researcher. Her contributions are major and have affected many lives.